We're going to discuss some of the ideas behind chiropractic right now. The ideas that you're going to see are courtesy of this fellow that you see in the picture. His name is Charles Maurer, and he's a chiropractor here in Springfield. His practice seemed to have been thriving at least before COVID-19. For 3 or 4 years, he would come and present to this class about the ideas behind chiropractic, but then because of the busyness of his practice was unable to do that anymore, so I'm going to continue the best that I can. Now, some of you may be wondering why we should think about chiropractic anyway. But chiropractic is really common. As you see, there's over 33,000 practitioners working full-time in the U.S., and over 31,000 of them are in private practice. 8% of all adults and 3% of all children see a chiropractor over the course of the year. So it's very likely, if you're in any sort of musculoskeletal practice, that you'll see people who had been seen by chiropractors are being seen concurrently by chiropractors, or may have even been referred by chiropractors. So understanding some of the ideas are really important. I think that one of the reasons that the utilization is so common is that, at least in the past, the advertising and marketing was really aggressive. You used to see these types of advertisements in print all the time. One expression that has a unique meaning in chiropractic is subluxation. There's the medical subluxation, which means a partially dislocated joint, but in the realm of chiropractic, it has a different meaning. Now, it had referred to what was believed to be, at one point, an actual anatomical malposition. A generation or two ago, chiropractors would take AP x-rays and then draw arrows and X's on the x-ray to show patients, you see, your vertebra is subluxed in this direction at L4-5 and in this direction in L5-S1, and we're going to do these adjustments and put it back in place. However, most contemporary chiropractic thought that is no longer believed. What is believed about subluxation is, instead of a malposition, they're an intersegmental movement disorder called intersegmental fixation, and that causes nerve interference somehow. So, as Dr. Maurer had described, two distinctly chiropractic conceptions regarding these subluxations are, first of all, they are correctable by what chiropractors would call adjustive, or what we would call manipulative procedures, and subluxed vertebrae somehow interfere with proper neurological function. The slide within my slide that you're looking at is from Chiropractic Education, and the principle that it's showing is really not controversial. We've spoken about this in a few classes. So what you see on the left side of the Chiropractic Education slide is collagen fibers and the lack of movement. So without movement, collagen fibers will mature into a disorganized web. So they are binding down surfaces that should not be bound down in directions which they should not be. But on the other hand, they are not strong in the direction that they should be when they're aligned by physiological movement, as you see on the illustration on the right side of the slide. The most contemporary philosophies of chiropractic describe how this hypomobility, or intersegmental fixation they call it, will cause altered intersegmental movement patterns and result in compensatory changes in muscle recruitment. And the hypomobility will cause cellular damage at particular sites, because remember that joints need movement for nutrition and oxygenation, and cause a condition which is called in chiropractic circles immobilization degeneration. Once you have intersegmental fixation or hypomobility, which can occur even without complete immobilization, you get decreased mechanoreceptor activity, which causes impaired proprioception. That's really not controversial. There has been enough studies showing this finding to generate a meta-analysis. It is believed also that with this decreased mechanoreceptor input, you have increased nociceptor input, which causes increased pain. The degeneration of the joint complex, it can occur within 1 week of hypomobility. And pre-existing problems due to trauma can increase the immobilization. Therefore, chiropractors would argue that any patient with a history of spinal injury should be evaluated by a chiropractor whether or not they're symptomatic. And further, that the tissue changes from immobilization can be reversed through remobilization through chiropractic adjustment. This is the ideas that underpin the frequency of treatment that you're likely going to encounter. When a person has an injury that a chiropractor frequently feels is appropriate for treatment, they'll recommend treatment 3 times a week for the first month, 2 times a week for the second month, once a week for the third month, and once a month for the duration. I will let you guys go ahead and read this, but this shouldn't be surprising to any of you. I know I've talked about it in biomechanics, and I believe that the guys from the musculoskeletal programming have talked about this. We're certainly going to talk about this in sports physical therapy for those of you who are taking that class. What this is describing is just what you see in a condition of tendinosis, for example, which resembles the tissue being arrested in the proliferative phase of healing and not going on to the maturation stage of healing. This diagram here represents tissue with collagen going in a non-productive direction, which is what defines intersegmental fixation according to the chiropractic view of injury. And here is collagen that has been realigned through chiropractic adjustment. So the idea is very sound, and how we understand remodeling of scar tissue and collagen as it goes through that remodeling phase. The type 3 collagen fibers that are going in a non-productive direction are broken because they're not very strong, and the collagen fibers, type 3 collagen fibers that are going in a productive direction, are elongated. So chiropractors argue that the frequency of treatment is not to actually treat the sprain or strain of new injury, but to help with the remodeling of collagen fibers between joints, allowing for strong productive tissue and helping with the associated neurological consequences, some of which, like impaired proprioception, are really not controversial at all. Okay, so the following you see straight from Dr. Maurer's material. I'll let you go ahead and read that. And the only thing that I would think, or we as physical therapists might think is controversial about this, is that passive movement, which is what chiropractic adjustment or manipulation is the best way to accomplish this connective tissue remodeling. especially with the frequency that is usually done with this type of treatment.